like to thank Miss Irish and Fan Hospital that give us a chance to be with you here. And we are super excited today that to talk with you about the advanced dressing role in the management of wound care. Because as per we know that to have a new wound care or wound care dressing advanced, it's something new which have not been widely used before here. So this is our honor to be with you now to give you a complete details about the role of the advanced dressings in the management of the wound care. As we are a new company, I would like to give you a brief at the beginning about the company. Our company called XU Healthcare, and XU name is coming from exceeding expectations. We are always want to be perceived in exceeding expectations of our healthcare professionals, our customers, and our patients by providing them a premium and innovative products to allow them to get cure and relief very fast. We have been established the company in 2017. We thought about the pillars, how we built our company in two pillars to focus on the geography, which is the Middle East, North Africa region, and what are the healthcare sector focus. We already have started the company by launching some of our products in UAE and Saudi Arabia 2.5 years ago, focusing on three main healthcare sectors, which are oncology and cancer, pain, and rare disease related products, surgical and wound care related products, and at the same time also we are taking care of some consumer healthcare products in the retail pharmacies and some of the polyclinics. So this is our main business focus, how we focus on that. So today we want to speak with you and give you a brief about our wound care and surgical portfolio. We provide you with advanced medicated dressings like silicone AG dressings, like silver alginate dressings. We provide you with advanced non-medicated dressing like silicone foam, like biofoam, like super absorbent, alginate, hydrogel, genuine fiber, all these included in our portfolio. Also, we have some of the traditional dressing for IV fixation, transparent film, biofilm, one of innovative product which is a silicone post-op to be used post-surgical when we speak in details about it later. We have a novel wound closure device, the innovative simplicity in wound closing, which is called Sequahol, that you close the wound without using a stitch or a stapler or glue in a very simple and easy way. So, frankly speaking, or briefly, we are provide the healthcare professional who are dealing with the surgical wound and wound with a holistic solution. It's around 95% of the dressings that you can use with any wound which you have. After 2.5 years, in the UAE and Saudi Arabia market, we have been widely used in a big accounts and big hospital, either in the private sector or in the governmental sector. We are available here in Saudi Arabia under NOPCO platform, so we are highly susceptible now or highly accepted in mostly of the governmental hospitals in Saudi Arabia. Also, we are being available here in Romania, Riyadh Care, Al-Fan, so now Al-Fan, Saudi German, and Faqih Hospital. So all the big institutes in the private sectors, either in Saudi Arabia and UAE as well, will have been available there, not only available, but have been widely used with a very, very positive feedback about our product. And we have replaced a big multinational companies from these hospitals. So, we're talking about the advanced dressing role in the management of wound care. So at the beginning, we would like to understand the wound classification, because the wound, it has different types of classification. Somebody can classify the wound as per the time to be healed. You can say it is a chronic or acute wound. Somebody classified as per the time or the depth of the wound, if it is superficial or deep or cavity wound. Somebody, they can say if it is infected or non-infected, about the big wound or small size wound. Another school, they are classified the wound as per the color. okay, or as per the Dyke's technique. What is that? Which is the necrotic wound, the necrotic tissue cells, they said black wound, the infected wound, it is yellow wound. The wound which is in the granulated phase, it is the red wound, and in the epithelialization phase, which is the pink wound. Another type of people or healthcare professionals, they classify it as per the indication. They can say it is a pressure ulcer wound, or it is diabetic foot ulcer wound, or it is leg ulcer wound. It's different from one to another. So you can say that I have a diabetic foot ulcer wound, which is infected cavity yellow wound. This will be the classification like that. And this will help us how to use the advanced dressings in which type of wound when we speak later about each product of what we have and how you can use to get the optimum benefits from it. So, how many of you here are dealing with long-term admitted patient, ICU? Okay, so the most critical thing in the ICU for long-term admitted patient is how to prevent the pressure ulcer. Okay, and this is how the nursing team is going to be evaluated at the hospital for the JCI to reduce the number of incidents of pressure ulcer happen. Not to treat the pressure ulcer itself, you have to prevent it from the beginning. So the pressure ulcer is defined as a degenerative change caused by biological tissue in the skin or underlying the tissue which is exposed to the pressure of the body to the bony area and the shear and friction. So if you assume that the patient is lying like that, here is the bony area of it, and the body make a pressure or apply pressure in the skin tissue between the bone and the body itself. And at the same time, when you start to move the patient, he can also develop a shear and the friction force. What is the difference between the shear and the friction force? The shear force is always happening inside the tissue cells itself, while the friction from the top of the tissue or the skin. So this is the definition of the pressure ulcer, that always there is a compression force on the skin or in the bony area, and also if there is a shear or friction forces that can happen. It has different stage of different appearance from stage 1 till stage 4. It appears at the beginning, as you see, like a skin irritation, then start to becoming more deep and wider. It depends on the way of treatment you are using with it. To treat a pressure ulcer is not only using a dressing, it is a multi-factor approach to treat it with different types of tools and medication. So where are the most common sites that the patient develop a pressure ulcer? As you see with me here, the most common site is the sacral area, the heels, claves, scapulas, skull, okay? It depends on the position and for how long the patient has been stayed for a long time in which position of what he has. Which scale you are using here? Which type of assessment tool? Is it a Braden scale or different types? Braden scale, exactly. Because Braden scale is the most widely used assessment tool to detect if the patient at risk for pressure ulcer or not. Okay, so you are, as you see, measuring different factors, which are the sensory, moisture balance, activity, mobility, nutrition as well, and friction and shear. So the lowest score is the highest risk of the patient to develop a pressure ulcer, while the highest score is the lowest. When we can say that this patient is at risk of developing a pressure ulcer or pressure injury, as per the new definition, when the score started from 15 to 18. This is the score, if it indicates 15 points or 18 points, so that means that this patient is at high risk of acquiring pressure injury or developing a pressure ulcer. So based on the scores, if the score starts from 13 to 18, we have different type of approach, from frequent turning of the patient, we start to maximize the rib mobilization, putting him in a lateral position, to use some tools or dressing to make a pressure reduction, to make heel protection, and at the same time to manage the moisture and the friction which can be used. So here comes the role of the dressing